Hey guys, thank you for sticking around. This is Vivas. My name is Shankri and this is Sharita. Now, over the course of the last 6 months, we've become extremely enlightened about all matters of women's health thanks to Dr. Sharat Ratna. Now, he's shared his vast experiences in obstetrics, gynecology, reproductive medicine and sexual health with all of us here on Vivas, and today marks his final episode with us. Now, he joins us now to discuss sexual health in women and what we should know. Welcome back to the show, Dr. Sharat.
Nice to be back.
All right.
I guess congratulations are in order. You're a doctor too.
Thank you very much. But still, I feel a little nervous because then, you might test my knowledge.
No, I'm not going to do that.
Well, we're ready to dig deeper
You're here
in
to
now.
test my knowledge.
Oh, okay, wow. Right.
Now, Doctor, we have discussed over the course of the last few weeks different aspects of, women's sexual health, and now we're kind of drawing to the end. When does a woman's sexual desire really decrease in life?
Sure. It's a complicated question. It's not easily explained or understood either. It's very unpredictable, and there are various biopsychosocial reasons why a woman's desire reduces.
When you say biopsychosocial, what do you mean?
Yes, I'll come to that soon.
Right.
So it's all to do with testosterone. We've seen the two hunks just now, who had MMA. They have highly performance orientated, highly motivated. It's the same in a woman. You think of testosterone as the male hormone, male sex hormone, but it's also present in women. It's about 1/10 the level in a man.
Okay.
So it's 1/10 of testosterone is in a female, but at any one time, there is more testosterone than estrogen in the woman. And testosterone is needed for all these things like bone health, muscle strength, bone density, and generalized well-being and mood, and of course, sexual desire, interests, thoughts and fantasy, plus motivation, right? So testosterone levels gradually decline over the years, all right? So you'd expect testosterone levels in a woman to be half of that, of what it was in her 20s at the age of 40. So when she's 40, you'd expect testosterone levels to be half of that, of what it was at the age of 20. And it needs to do all these different things, and it is produced mainly by the ovaries and the adrenal glands in the woman, as opposed to the testes in the male, obviously.
Okay.
All right.
Right.
Now, the depletion of these levels,
Yes.
the hormone levels, are there any factors that causes it to deplete faster, or is there anything that the women out there can do to actually slow down the depletion?
Sure. The decline is unpredictable. There's no exact cutoff or limit at which it occurs. But sorry to interject just now. The various reasons can be divided into biological, psychological, and social reasons. The psychological and social reasons account for the vast majority of reasons why women's sexual desire reduces. Okay. Psychological reasons such as anxiety, depression, mood disorders are very common in women, and especially if she has a low self-esteem or a poor body image. These are common things that occur in women, and this can affect a desire. Other things would include physiological things like having a pregnancy and delivery. That's when your testosterone levels drop. In fact, after a marriage, the testosterone level tends to drop also sometimes. And it tends to increase in men after divorce, interestingly.
And
right?
why?
Yeah, if you don't know. So these are all the things. These are all the biological factors. And the psychological factors, the social factors would include things like having a marital affair, for example, or in a very bad, toxic relationship. If the relationship isn't going very well, no matter how much testosterone you give to replace it, it's not going to make it better.
Oh, wow.
Yes. So you have to correct the social problem, which is the relationship problem, and things like that. And of course, there are some medical conditions that can cause desire to drop. If you could think of menopause as a medical condition, it declines gradually over time, over age, menopause. I've spoken to you about pregnancy and breastfeeding. Other medical conditions would be chronic illnesses such as hypertension and diabetes. That's very common. As you get older, you're going to get all these things. then of course, as we've alluded in the past, psychological illnesses are getting more and more common. SSRIs, which are antidepressants, are very commonly prescribed. They're another cause of reduced desire.
Wow,
so the list can go on and on and on.
It's a very,
But
very broad list.
Yes, but the vast majority are psychological and social reasons.
Having said this, when and how would a woman or even their spouse know that the decreased desire is actually a cause for concern?
Yeah, it has to be eliminated. You have to look for a cause. But of course, they're going to present with, possibly a sexless marriage or a restless marriage, as I call it, where monogamy may not be the only thing. In a relationship, there's an initial period of time called luminescence, where everything is high and you're in love, your oxytocin is flowing, sex hormones are flowing, you're highly stimulated. And then after that, it tends to wane off and die as time goes by. So, one of the things that have, been used to describe this is luminescence and, being restless, looking for something else.
All right. Now, oftentimes we would think that these problems, reduced sexual desire, is an issue for women who are over 40 years old. But sometimes it can actually happen in women who have just gotten married, who are in their early 20s even.
Yes.
What causes this?
Yeah, that's a very good question. But of course, we'll have to look for all those psychological and social reasons first. But commoner medical reasons that can be attributed to this would include things like painful sex, dyspareunia, and that may be due to a variety of different reasons. It could be either superficial, due to, say, a recurrent vaginal infection, or it could be deep, due to underlying gynecological problem. But other reasons that may also contribute to this would be something called vaginismus, where there's involuntary, uncontrollable spasm of the vaginal wall, and that causes difficulty in penetration and painful sexual intercourse. I think if you've excluded all the possible medical reasons, then you have to go down the psychological and the social route to see if there's anything else there. But at the back of one's mind, you should always think about physical and sexual abuse in the past, or child abuse, or something like that. Of course, it's very rare, but it's something that you don't forget. I think something you should think about.
Yeah. Now, all these problems are something that isn't very, often discussed amongst women openly. How would a woman know when there is a cause to be concerned about, or something that they should really come forth and discuss with their doctor?
Yeah, women don't come forth very openly to discuss these things. Sometimes it's teased out at a history, when you're talking to the patient, when you're having a conversation with the patient, and sometimes it's probably the last thing they tell you before they leave the room. It's called the hand at the door syndrome. As you're about to leave the room, they turn around and tell you, by the way, doctor, I've got this problem. What do you think? It's usually that sort of thing.
Yeah.
And most, suffer in silence. Most suffer in silence.
Why do you think this is so? Why are women...
There's a taboo attached to it. People don't talk about sex openly. As I think I've said this before, I think the younger generations now are not too shy about it. The slightly older generations are slightly more conservative.
And I think what's very important is that their partners or their spouses, they play a very big role in this too. What should a spouse or a partner do to help these women who are suffering with, perhaps a decrease in sexual desire?
Yeah, a very difficult question again. So if it's psychological, then, and if it's it's appreciated by both, then some form of marriage counseling or psychotherapy would be advised. If it's psychosocial reason behind it. But if it's medical, then treat the underlying medical problem. Spouses have to play a very supportive role, and it's a two-way thing. It's both ways.
Doctor, earlier you mentioned a little bit about vaginal dryness. What are the effects of this, and how can this really be addressed?
Okay, there are various causes to vaginal dryness. The commonest reason I see in this country in younger women is the fact that women use vaginal washes, feminine wash and intimate wash and things like that. The vagina is self-cleansing, right? And there's no reason to use any form of soap or things like that, because if nature meant the vagina to be smelling of roses or lavender, it would have designed it to be that way, a bit of roses. But it's not meant to be that way. It's not meant to be overwashed and watered too much.
Yeah.
And that is the biggest reason why you have dryness. And as a result of the dryness, you get pain during sexual intercourse. And as a result of that also, of the dryness, you get recurrent infections, vaginal infections, such as candidiasis, thrush, bacterial vaginosis, and things like that. And that actually makes the problem even worse.
You know, that's true, doctor. There are, a lot of articles these days circulating about, vaginal steams and vaginal masks and bleaching. It's become all the hype for women to really try and make, I don't know what they're trying to do. What are your thoughts on all this?
Well, I'm against all of this. As far as I'm concerned, it's self-cleansing, and you should limit washing to once to twice a day. What I find is that Malaysian women tend to wash every time they go to the toilet, and then then they use tissue paper, and then you get tissue paper being stuck and all that. That's a source of infection. So what I'm trying to say is that none of this is necessary. Limiting your washing to once or twice a day when you're having a shower is more than enough, and not the inside, not the inside lining of the vagina. That's where the protective bacteria is, and if you're going to remove that, then you're not going to have any protection, and you're going to have recurrent vaginal infections.
There's also a certain pH balance that needs to be kind of maintained.
That's right. It has to be a low pH balance. That's right.
All right. And what about the use of panty liners?
Yes.
Some women wear it, or even pads and tampons. They
Yes.
wear it for too long.
That's right.
Some women wear those that are super absorbent.
That's
So
right.
what are your recommendations with
Yes,
that?
I'm a fan of panty liners. I tell my patients who have this urge to wash every time they go to the toilet to use panty liners instead, not the scented ones, and then just put them on, and then one for the day and one for the night, and that should solve the problem. That is if they have recurrent infections and things like that, and that's one way of doing it. Of course, antifungal therapy would be another way to prevent all those infections, but definitely no scented panty liners, no synthetic underwear for long hours of the day. Tampons, definitely, if that's a trigger, definitely not use it.
Speaking of vaginal dryness, one of the remedies was said to be a kind of treatments of estrogen levels or testosterone levels, and a lot of women are very apprehensive on using these treatments to kind of get rid of their issues. What do you have to say about all this?
Yeah, it depends on the age group of the women. Younger women shouldn't have a problem. Testosterone is there to in fact, keep vaginal health, to maintain vaginal health.
Yeah.
So you're going to have enough estrogen and testosterone in you to maintain vaginal health in a younger woman. An older woman, as you're going through the perimenopause and the menopause, that's different. You're going to have vaginal dryness. You're going to have a low estrogen state, a low testosterone state. So therefore, some form of topical estrogen, which is estrogen locally, that at the level of the vagina, would be highly beneficial.
All right.
Okay.
Now, doctor, we've covered about the hygiene and also vaginal dryness and sexual desire. But one more issue that's still very prevalent in our community is sexually transmitted diseases. Now, what can women out there do to prevent sexually transmitted diseases?
Right. The only way to prevent it totally is abstinence, right? But if you're having sex, then condoms are protective. They're highly protective against sexually transmitted infections. They protect you against common sexually transmitted infections such as, chlamydia and gonorrhea, and then trichomoniasis, right? But it doesn't protect you against sexually transmitted infections that are on the skin. For example, the scrotal skin, for example, such as warts and herpes. So you still can get a sexually transmitted infection that way. So the next bit of the equation would be monogamy.
Okay.
Or, you know, having a stable relationship and not having too many partners. And with barrier methods of contraception all the time.
All right. Now, if one is in a monogamous relationship, it does not mean that they are entirely protected from STDs or
Absolutely.
sexually transmitted diseases.
Yes.
In fact, many of them come in with diseases because one of the spouse, goes astray and,
Absolutely. Yeah.
has another partner.
Yeah.
Now, are there anything that you would recommend couples to do to ensure that both their sexual health are in good
Yeah, I think
state?
what you're pointing towards is this interesting term called serial monogamy, where you have one boyfriend for 1 or 2 years, and another boyfriend for another 2 years, another boyfriend. So you've had several partners in your lifetime before you want to have kids and things like that. So that's definitely where you get exposed to sexually transmitted infections. Most of them are silent. You can't really see it. And even herpes can be carried and not knowing about it. And HPV is another big one, which is the biggest cause of cervical cancer.
Yep.
That 80-90% of the American population have HPV on them, and that's transmitted sexually. So the best way to prevent it is avoiding too many relationships and barrier methods.
All right.
Yeah.
Now, Doctor, we've covered a lot of different topics through this entire series on women's health. Do you have any last advice for women out there regarding their sexual health?
Well, I think it all comes down to improving general health. In most cases, it's if you have a healthy diet, you're exercising regularly, and you're doing all your screening regularly, which is, your pap smears, your breast examinations, and your pelvic ultrasound scans and things like that, you should be okay.
All right.
All right. Well,
That's very simple things to do, and if everyone does that routinely, I think the women out there will be protected.
Yeah.
And Dr. Sharad, thank you very
Thank you
much,
so much
for joining us on Vivas and taking us through this journey of
Great.
enlightening not only us but also our viewers on issues that are so sensitive and people don't really wish to tackle
Great.
those issues.
It's been
Thank you very
great
much.
fun. Thank you so much. Thank you very much.
Shankri, I do enjoy those little interviews where you get to learn a lot more about things that, as you said, people don't talk about.
Ask questions. Exactly,
Yeah.
Sharita. I've had, for the longest time, I really didn't know what to do. And, it's good that we have this conversation so that we do understand what is necessary to do.
Indeed.